let's bring in ABC News medical contributor Dr. Jay Bott to break this all down for us. Dr. Bott, thanks for being here. How big of a development do you think this is to have big pharmacy chains like Walgreens and CVS starting to administer COVID vaccines?
Diane, thanks for having me. I think it's incredibly important. We know pharmacies have been a mainstay for flu shots and shingles vaccines and other immunizations, and we know that the industry is capable of vaccinating millions of people on a monthly basis. So this will provide vaccinations in communities, gets those shots into arms, and help us try to manage this race against time with the variants that are emerging. And so it's critically important. They're trained and they know how to do this. And so they've got to be one of those sites that people can go to because it sort of meets them where they're at.
And now we just heard some states are rolling back some of their COVID restrictions in the next few days. On the one hand, there are lots of concerns about these new variants out there. On the other hand, numbers are declining and we can't stay shut down forever. So what do you think about the timing here?
So I think that I know it's hard. People want to get back to their daily lives. They want to do the things that they used to do. They want to get moving. But we've seen this story come to us before where we get lax, we let our guard down, and cases rise. And we don't yet know the impact of vaccinations. We know that in certain communities, it's certainly making a difference, and we know that over the long term it will. But it's critically important that we mask up, we keep our distance, minimize those household gatherings, and ensure that we're doing the things we need to curb transmission, because the less community spread there is, the less cases we'll have, the less hospitalizations, and the less deaths. And
is there a sense of how much the lower case numbers we've seen lately are due to vaccinations?
Yeah, so given so far about 10% of Americans have gotten at least one vaccine dose, it's impossible to know the causes of declining cases and hospitalizations given so few of the population has been vaccinated. Part of immunity is not only immunity delivered by vaccinations, but also natural immunity for those folks that have gotten infected with COVID-19. And so we've seen in certain communities and certain groups of people where it has made a difference. For example, the LA Fire Department had 75% of their folks vaccinated, and their daily number of positive tests have dropped. So this is a sign that the vaccines are showing impact just as they did in their clinical trials. And just I know colleagues of mine who have gotten vaccinated versus those that haven't. And in even small groups, those folks that have gotten vaccinated have not tested positive, whereas those that have not gotten vaccinated have. So we're seeing real life examples, and I think it's going to take some time before we quantify it at a larger scale.
Facebook also now says it's launching a campaign to correct vaccine disinformation. What are you hoping to see from this campaign? What kind of concerns have you seen in the communities you serve?
So I think we've got to do everything we can collectively to fight misinformation and the anti-vax movement. In my community, where 80% of my patients are Black, I've seen the challenges that the history of mistrust has posed. Tuskegee, Henrietta Lacks, and the everyday discrimination and racism that these communities might face that further contribute to mistrust. One myth about a vaccine side effect could lead to a community feeling very differently about getting vaccinated. 5% of Black Americans have been vaccinated versus 60% of white Americans in 23 states that are reporting. We know COVID-19 has disproportionately hit people of color and in poor communities, and we've got to do everything we can to help move them along to get vaccinated. And sometimes for my patients, it's not just the first conversation, but it takes 3 or 4 conversations. It takes me holding their hand. It takes me meeting them in their community in order to help them understand that we're here to support them, to keep them safe and keep their family and loved ones safe.
Yeah, and one concern that I've heard, this is both with testing and with vaccination, is that people are afraid they'll be exposed when they go to get the test or when they go, in this case, to get the vaccine. What do you say to that concern?
I think it certainly is a valid concern. I think then the conversation I've had with my patients, I know my colleagues have had, is that the places that are testing and vaccinating, by and large, are doing the things that they need to do to keep people safe. And I think it's those kinds of one-on-one conversations or larger scale education in communities that makes a difference. I also think that we've got to reorient people around the notion that there are vaccine side effects. It's really the difference between side effects versus the immune system working once you get the vaccine to help build antibodies so that they can keep people safe. So I think also the conversation about, we live with coronaviruses every day, before COVID-19 and after COVID-19. And so it's really about getting people vaccinated and safe so we can decrease community spread and treat it like we do other infections.
Dr. Jay Bott, great to have you here today. Thank you.
Thanks for having me, Dan. Have a great one.
You too.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.